For a long time now, we've known that patients grind and clench their teeth, which does quite a bit of damage to teeth, restorations, and joints. And so we have often prescribed our occlusal splints, which are durable and give a lot of protection, but they can be kind of cumbersome and clumsy. So now we are using our nylon splints, which you can see are much thinner, they're much more comfortable, they do the same job, but just more comfortably. And they are just as durable as the old version. So if you are one of those patients who have benefited from a splint before, but would prefer a more comfortable option, the nylon splint is the way to go. Crosspoint.